From the KBJR TV studios, you're watching the news at 6 on Northern News Now.
Good evening, I'm Laura Lee.
And I'm Dan Wolf. Thanks for joining us. It might not be top of mind anymore. That doesn't mean COVID has gone anywhere.
In fact, the Centers for Disease Control and Prevention say COVID hospitalizations across the country are up 14% right now.
We're also seeing an increase in our region. Northern News Now's Natalie Hepner explains why and how you may need to prepare for multiple respiratory illnesses this fall.
The CDC says COVID-19 numbers are on the rise nationally and in Minnesota.
COVID's not a thing of the past. There's still a lot of COVID out there, and there's still significant disease and death that occurs due to COVID.
Dr. Andrew Thompson, infectious disease physician for St. Luke's, says the state has seen a gradual increase in cases over the past month and a half. The Midwest has seen almost a 7.5% increase in COVID-19 cases over the past 4 weeks, according to the CDC.
Compared to our last waves that we had in prior years, this is really small, but it's still a significant increase. It's a little above what we were early in the summer.
Each hospital reports COVID-19 cases to the Department of Health, but another way officials track COVID cases is through our wastewater. Dr. Thompson said officials can test sewer system water and look at the level of viruses in the water, which gives health experts a better understanding of the COVID-19 spread in a community.
So we'll see the wastewater levels go up before we see people presenting to care, coming into emergency rooms and things like that. And it tracks quite well with disease activity.
This fall season, COVID-19 isn't the only respiratory illness that could get you sick.
Flu, RSV, and COVID, those three big respiratory illnesses that we are concerned about at this point.
Health officials say the best way to protect yourself is to stay home when you're sick and get vaccines. Dr. Thompson says an updated COVID-19 booster will be available to patients in the upcoming months.
The original vaccine would have decreased effectiveness, but this updated vaccine does work against the currently circulating variants, the XBB strains.
Keeping health top of mind as summer comes to an end. In Duluth, Natalie Hepner, Northern News Now.
And Dr. Thompson says flu vaccines will be available at St. Luke's in the coming weeks and recommends to get all of the vaccines you need at once to be protected.
If you do test positive for COVID, the CDC still recommends quarantining for 5 days.